Quality Management and Benchmarking presents Samvaad QMB, Conversations on Quality at Symbiosis International University.
Hello Symbiosis, this is Dev Sanyal and I bring you the second episode of Samvaad QMB, Conversations in Quality, Season 2, an initiative by Quality Management and Benchmarking here at Symbiosis International University, Pune. The focus of today's episode is one of the fundamental aspects of our university life, which is quality in healthcare education. Now, Symbiosis International University commands a unique position when it comes to healthcare education. The Symbiosis University Hospital and Research Center has not only emerged as one of the leading medical facilities in the greater Pune region, but also one of the foremost institutes when it comes to healthcare education and medical research, which means that for every upcoming medical professional, student and researcher associated with SUHRC, we not only provide the opportunity to stay on top of emerging trends in local and regional medical conditions, but also learn from some of the best medical practitioners in the region. But with such great opportunities also comes important and challenging responsibilities. To shed light on both these aspects of healthcare education, today we have with us Dr. Rajiv Yeravdekar, Provost, Faculty of Medical and Health Sciences here at SIU. Dr. Rajiv was awarded a PhD under the Faculty of Management by Pune University. He is a member of various government bodies including MCI, Central Supervisory Board, Maharashtra Medical Council, Maharashtra Nursing Council, Consultancy Development Center, DSIR, etc. Professional organizations like FICCI, Nat Health, etc. He was also invited by the Ministry of Health at the Sultanate of Oman. He is also a member of the steering group of international health promoting universities and colleges, the working group of UGC to bring out policy on health promoting university, the Fit India Movement Campaign Committee, MHRD, Government of India. He has been nominated on the WHO project on development of health and wellness assessment index for higher educational institutes in India. Finally, Dr. Rajiv has been nominated by the Honorable Governor of Maharashtra and Chancellor of Universities in the state as the Chancellor's nominee on the Senate of the Maharashtra University of Health Sciences. Dr. Rajiv has contributed a number of articles in various national and international journals and has constantly championed the concept of health promoting higher educational institutes in India. Welcome to Samvaad QMB, Dr. Rajiv.
Thank you. Thank you for having me over.
There are some very interesting things happening around healthcare education in SIU. And I wanted to begin by locating healthcare education within the larger picture of higher education institutes in India. This is a post-pandemic world of healthcare, right? And in this present context, how do you see health education and its contribution to nation building?
Well, at the outset, I would like to congratulate the QMB department to come out with this concept of Samvads, having a dialogue with stakeholders, because it ensures participatory management and evolving a consensus policy on various aspects. As you rightly mentioned, the post-COVID era, as has been mentioned in many articles, is that of a period of VUCA. V, volatility, U, uncertainty, C, complexity, and A, ambiguity. We never knew how our lives would be turned upside down when we entered Corona in 2020. And in 2022, we were reeling and we still continue to learn from what COVID has taught. To many, the COVID pandemic was a disaster. to many also it has turned out to be a great teacher, because it taught us many things which we were loath and resistant to adopt. Right. The principal thing which we were loath and reluctant to adopt was the adoption of technology, especially in the healthcare. So, healthcare has transformed significantly in the post-pandemic area, and that has had ripple effects or spin-offs on the way it has led to community empowerment. And when I say community, it not only means the healthcare community, but the nation at large and the world in its entirety. And I am particularly glad that you use the word healthcare education, not medical education alone, because healthcare is beyond medical and includes nursing, allied healthcare professionals and various other trades which effectively contribute to the optimal delivery of healthcare. So, answering your question as to how healthcare or an unfolding of the healthcare sector contributes to nation building is the fact that healthcare leads what we talk in the sphere of health promotion, and health promotion is again beyond health education. Health promotion is the pervasion or invasion of various aspects and dimensions of undertaking health in a way which includes nutritional literacy, it includes physical literacy, it includes lifestyle modifications, it includes interventions and a gamut of operations which help us lead a healthy life, make healthy choices and ultimately contribute to a healthy nation and a healthy world. Back in the US, they had launched, the UN has launched or the WHO has launched a healthy people movement. And the good thing of this healthy people movement is that what healthy nations they want to see in 2020, the task force was formed in 2010, at least a decade back. So, we are now working under the guidelines of the Healthy Government, Healthy People Initiative 2020, which will evaluate the impact of the policies recommended by this group in 2030. So, it is a very forward looking prospective initiative launched by none other than the apex body governing health standards globally, the WHO. Right. With health promotion comes adopting a healthy lifestyle, making healthy choices, not indulging in risk behavior, or if indulging in risk behavior, it is an informed consent. I know that if I smoke, I am exposing myself to the risk of lung cancer. I know if I drink, I am incurring the risk of damaging my liver. Yes, we are not here to morally police, but we are here to make you help make informed decisions, what we talk in medical parlance as informed consent. You know the pros and cons, yet you choose to enjoy, inverted commas, that particular substance or indulge in that risk behavior because of the thrill which you get, whether it is drinking, whether it is smoking. So, health promotion leads to community empowerment leads to community economic development, which in turn leads to national development and which leads to adoption of best practices which are prevalent in other western parts or the developed countries, which we as a developing country need to adopt, and conversely we as a developed country, for example yoga popularized by none other than Honorable Prime Minister, can export to the outer world, talking about the benefits and virtues of holistic understanding of health, as was promulgated by the Honorable Prime Minister when he inaugurated the Arogya Dham at a very Symbiosis International University campus on the 6th of March 2022.
Right. These are some very interesting points, and what I thought was most interesting is coming from what you said is that it is not just a medical practice, it is not just about medicines, it is not just about healthy practices, but it is a much more comprehensive approach to healthcare.
Absolutely.
Right?
Holistic approach.
Holistic approach to healthcare. So, which then brings me to the next question, especially when we are talking about healthcare education. How do you define and measure quality in healthcare education within SIU, within this holistic approach, right? And how do you foster a culture of continuous improvement and quality assurance among faculty, staff, students in healthcare education, again with an eye on this, not just a focused on medical research and medicine, healthcare, this thing, but a holistic approach?
Well, go by the basic management principle, good input results in a good output.
Right.
So, the students we select are through a rigorous and stringent process. They are selected with the right attitude, the right aptitude, the right intellect, and they know what they are wanting to be at the end of a program in MBBS or a program in MBA hospital healthcare or a MSc in dietetics and nutrition, MSc in biotechnology, nursing program, sports management, the various programs. The students are selected with a very focused and a customized selection procedure, which evaluates whether the student wanting to pursue a program is the right fit for that particular program. Secondly is the subjects which we teach are curated from the best existing globally. We research on what are the best practices in higher educational institutes of the stature of a university, comparable to that of an international university like Symbiosis, whether that can be adopted to Indian standards. The faculty that is selected to teach this are of two types: the hardcore teachers who come with the educational background experience and expertise, and also the industry champions or the people who come with the on ground field experience, who can translate their practical experiences to theoretical desk knowledge, so as to say. There are some soft skills which we also teach to make the student passing out to the portals of this august institution not only, as we say, patient ready, but patient safe. But at the same time, certain values are inculcated through the unique ecosystem of Symbiosis. Say for example, initially we used to talk about IQ. Development of an IQ was a KRA of educational institutes. Then came the era of EQ. We developed a EQ amongst our students. But probably today I have to teach my students and help them inculcate a quotient which is called as AQ, adversity quotient. How do I build up a resilient student who at the end of his tenure is trained to accept a no, trained to accept something which is not exactly as per his wishes or as per his expectations, trained so that he stumbles, falls down, but has the ability to get back, stand up and bounce back into activity.
Right.
These are some dimensions. Feedback from students as regards the program structure, the pedagogy of not only teaching, but the pedagogy of assessment. And just to give you an example, today simulation based pedagogy is coming a big way into healthcare, especially in medical education. And the beauty of simulation is where we learn on mannequins. See, when we were medical students 40 years back, we learned on patients using patients as guinea pigs, which is unfortunate. Today, an informed patient aware of his rights with the Human Rights Commission, and rightly so, not allowing us to use patients as guinea pig. Where do I learn my trade? Simple thing of how to give an injection, how to set up an IV line, how to perform an operation. Here is where simulation comes into existence and has a rightful place in the training or learning curve. We learn on what we call as mannequins. We learn on what we call as task trainers. We learn from training videos, which allows us to make the mistake and mistake and mistake till we become perfect. Practice makes one perfect. And practicing not on patients, but on mannequins or models, where we can make mistakes and learn the repercussions of our mistake. And a beautiful concept which is there in simulation pedagogy is, I do a procedure on a mannequin, the examiner is watching me, he allows me to complete the procedure, and at the end of the procedure he has got a session which is called as a debriefing session. He does not stop me when I am making my mistake, because he is not going to harm anyone. At the end of it, there is a recording which is shown. This is what I did wrong. this is what I should have done later, this is what I should have done before, this is how I should have communicated to, say for the example, the anesthetist to push in this drug at this rate, at this time, all of which help in patient outcomes. So this is done even before the medical student physically touches a patient in the wards. So this is a pedagogy which has been inculcated in the medical curriculum, but we have extended it to the nursing curriculum, we have extended it to the other paraclinical branches, so that the patient is in safe hands, because our motto is, as mentioned in the Hippocratic Oath, first do no harm. Feedback and consultations with stakeholders, which includes the students, which includes the patients, which includes the regulatory authorities, and our National Medical Commission, or the, for example, the Indian Nursing Council, are very strong statutory bodies which ensure the enforcement and monitor the implementation of program guidelines, not only the subjects we teach, not only the chronology in which is taught, not only the assessment strategies, but also the attainment of the learning outcomes. A seminal document which has been developed by the National Medical Commission, which has replaced the erstwhile Medical Council of India, is the ATCOM module. And AET COM is an acronym for Attitude, Ethics and Communication Skills. Because over the year we found out that healthcare professionals, particularly doctors, lacked this key concepts of attitude, ethics and communication skills, and we doctors or healthcare professionals were always accused of, and rightly so, as being poor communicators. We do not probably sympathize, empathize with the patients who has probably undergone a traumatic outcome. It may be the first time for the patient, but we face it day in and day out, which probably makes us blunt to human emotions. In a way that is right, but for the person who is facing this emotional trauma and roller coaster of an unfavorable health outcome, we have to extend a hearing ear and be able to communicate sympathetically, empathetically, compassionately. It does not matter which pathy you are pursuing, sympathy is the denominator, irrespective of whether you are practicing allopathy, homeopathy. Sympathy, the suffix of pathy is the common denominator.
Perfect. That's very interestingly and very nicely put, sir. But it also brings to me my mind of a couple of things, especially when you talked about the AQ, the adversity quotient, the fact that we are in an arena or in an era of healthcare which is changing rapidly. So, for instance, we have new emerging technologies where we have AI aided IVF procedures. We have, you talked about simulations, there are 3D printed limbs, there is AR, VR is now coming in, all of that. So, this brings me to a couple of questions. I will begin with, how does one assess the effectiveness of teaching methods and instructional strategies when the arena is changing so rapidly? And when the healthcare industry is rapidly changing, the demands of healthcare education is rapidly changing, how do you assess the effectiveness in this rapidly changing area?
So, assessment is by, first is seeing the attainment of learning outcomes. Right. So, every course is an outcome based education. Right. We see whether the student has attained the objectives by various assessment strategies. Right. Number two, there is a concept called as entrustable professional activity for the doctors. Say suppose for example, we are teaching a doctor how to perform a simple dressing. I won't even go to the operative. We tell the student in training to see how this dressing is being done. Then we tell him to do the same dressing on a mannequin. Then we see how he does it, evaluate. Then there is simulation. We teach them learning videos and see how the student acquires the thing. Then his performance in the exams, and ultimately when he passes out as a doctor, what has been his translation of the learning objectives or the learning courses into actual practice. So, suppose if I am learning as a gynecologist, I need to know how to conduct a normal delivery. I am taught, I am shown videos, I learn it under supervision of a mentor, I practice it under supervision of a mentor, and then I actually do it. And all this is assessed as to the attainment of the learning objectives. Right. So, an outcome based education translating into good healthcare delivery is the way through which we do it. And of course, technology comes to the forefront. As I said, simulation is a big impact. Ancillary aids like AR, VR, use of technology enabled devices such as the Anatomage and many other three-dimensional technologies which have invaded every aspect of life and more so in the healthcare, help us to visualize the basic anatomy, plan our operations and deploy techniques and tools to actually have a precision based approach. So, whether it is robotic surgery, whether it is cyber knives for brain surgery, that precision of surgical excision or a surgical approach is thanks to technology.
Right.
And AI and all those tools, cloud computing are there here, but I, as a hardcore non-technology based healthcare professional, would like to draw the attention that these are complements. They cannot supplement the softer haptic traits which are required in surgery. So, simulation on mannequins will never give me the exact feel of how I will feel a liver, a particular tissue, because the actual feel is, if not significantly different, at least a tad 10% different.
Right, right. I think you have preempted my next question in this, but I will still have to ask this because it is so interesting and so intriguing to think about, because we have these rapidly changing industry standards in terms of technology coming in.
Yeah.
But you said that while technology, these tools are very important to bring in, but they are still sort of complements.
Yes.
So, how do you then ensure that the curriculum offered at SIU while incorporates all these technologies,
Yes.
makes our students ready for these technologies, but also not lose touch from what you said, the core, the haptic sort of feel of medical. So, how do you ensure that?
Actually, patient care and real-time life field experiences given by the industry champions which I mentioned.
Right, right.
They can relate what works, what does not work. Case studies become a very important aspect of their teaching, and the student who actually in the course of his MBBS curriculum washes up, scrubs for and assists a surgeon in the type of surgery or conduct of a normal delivery, actually gains the hands-on experience which makes him patient ready and patient safe. Right. So, there is a gradual transition from, say for example, theoretical learning to simulation based learning in the Symbiosis Center for Health Skills to actually patient care under the guidance and mentorship of a faculty, doing those activities under the guidance and mentorship of a faculty, to ultimately migrating or graduating to do it independently. So, it is a learning curve where we monitor at every level what the learning objectives are, commensurate with the academic standing of the individual to hand him over the patient independently.
Right, right. Now, this brings me to the fact that when we are talking about evolution, we are talking about development. Whether we are talking about the evolution of an individual or an institution or an arena, evolution comes with challenges. And what would you say are the most immediate challenges that SIU, SUHRC is facing, is tackling right now, or needs to tackle immediately in terms of healthcare education and quality in healthcare education?
Well, the immediate challenges are generic to higher education and some specific to healthcare. Okay. So, there is the regulatory environment, there is the financial concerns, because healthcare education is a financially capital intensive education. Any equipment which you buy, any infrastructure you want to create is capital intensive. Number 3, you are dealing with life and death, you are dealing with patients, unlike what you do in an academic institution where we are not dealing with life and death. There are mindset challenges. Students do not want to learn something which they feel is not relevant to them today, though we may see them as futuristic trends. There are challenges of the accrediting system, there are challenges of quality, there are challenges of the West or the global well-developed industries, a well-developed world galloping at a pace with which we cannot keep up in the immediate time frame which we are looking at, and technology which is changing so rapidly. what was useful yesterday is not relevant today and may become obsolete tomorrow. So technology is constantly going to the next level to give us precision based images, which leads us to diagnose and treat a condition with almost 100% accuracy. Plus, if say for example both of us land up with a medical ailment, you have a different constitution, a different genetic makeup, your body is different from mine. So what works for you may not work for me and vice versa.
Sure.
So there is this concept of precision medicine coming in, where we work on your genomic or your genetic makeup to customize a therapy for you, which may not be the best for me or vice versa. So in today's world, it is more of precision, individual directed therapies rather than one size fit for all alone.
Right, right. So it is very clear then that there is a much strategization, there is a, there's a lot of thinking, lot of strategization that goes into, if I were to draw a medical analogy from the tissue to from the cellular to the tissue level to the
organ to the individual.
To the
Yeah,
individual.
absolutely, absolutely.
So, which brings me I think to the most important question. How do you strategize around with the stress? What is present on your personal music playlist? What are your web series that you are watching?
So, particularly I enjoy my work, so I do not see it as a stressor, but it is demanding and I like the demands, because every morning I get up, I say okay, what is there today? One is the homework of yesterday and the forework for tomorrow.
Right.
So, I am excited about what I am going to do on that day, and the challenge is to meet the deadlines.
Right.
So, achieving the same is not only a stressor, but sometimes when I want to switch off, my grandchildren are the best anti-stress agents. I got 3 of them. Music, old Hindi songs is sometimes my eternal favorite, and walks in this beautiful green campus is something which charges me all over again.
Great, great. Thank you so much, sir. I think those were some really insightful and some really interesting perspective on quality in healthcare education. I think we are all very informed, not just in terms of how the healthcare education aspect is working within SIU, but also the larger picture as well after this episode. But so far, this is all we have for today. We will of course be back with another episode on another important, crucial aspect of SIU and its environment and its family, the SIU family. Till then, thank you so much. Thank you so much, sir.
Pleasure having me over.
Thank you so much.
And glad to share my viewpoints.
Quality Management and Benchmarking presents Samvaad QMB. Thank you for your time and see you in the next episode.